everyone, I am Ms. Reyes from Work and Read Dental Hygiene College. Today we are going to go over a quick look at several instruments you as a dental hygienist may find yourself utilizing when performing prophylaxis on a patient. Alright, so to really understand these instruments, we're going to need to remember some key elements.
As we go into detail about each instrument, I want you to remember this efficient way to establish positioning. The first step is to start with yourself. You're going to want to assume the clock position for the treatment area. Once you determine this, you move on to the second step. My patient. The second step is the patient. This is when you should position the patient's chair and head positioning. My equipment. Adjust the unit light, pause, and self-check the positioning so far. My non-dominant hand. Adjust placement of the mouth mirror. My dominant hand. Adjust placement of the instrument.
Alright, so let's keep those steps in mind as we discuss these instruments. The first instrument we're going to be discussing is the 1112 Explorer.
The 1112 Explorer is an assessment instrument used to determine the health of the gingiva, tooth anatomy, and texture of the tooth. It helps assess progress and completeness. The working end is 1 to 2 millimeters in length and known as the Explorer tip. The vibrations are felt from the working end to the clinician's fingers. Therefore, it is made of a flexible metal. It is great to know that the actual point of the Explorer is not used to detect, as the side of the Explorer is adapted to the tooth surface. The terminal 2 millimeters of the side of the tip are adapted. The tip of the Explorer is at a 90-degree angle to the lower shank. This complex, long, and curved shank design makes it equally useful when working on anterior and posterior teeth in normal sulcus and deep periodontal pockets. The grasp on the instrument should be light enough so that someone could easily grasp the instrument and slide the Explorer right from the clinician's hand. So a good method for insertion calls for the clinician to adapt the Explorer tip to the tooth surface above the gingival margin at the middle third of the crayon. You're going to want to check and ensure that you have the correct working end. When determining the correct working end, you will see that it will curve inwards and essentially wrap around the facial surface of the tooth. The incorrect working end does not wrap around the surface of the tooth and faces away towards the gingiva. Ouch! Once you find the correct working end, you are going to gently slide the tip under the gingiva. The tip should be consistently in contact with the tooth surface. This is when you're going to want to initiate the assessment stroke by using oblique strokes across the surface of the root. These strokes are going to be roughly 2 to 3 millimeters in length. Now is not the time to daydream about removing the calculus on the tooth, so it's imperative to remain alert and focused. Using assessment strokes should be feather light, controlled, and fluid. They should not be robot-esque. This allows the clinician to really use that high degree of precision they require to detect possible anomalies. As we work across the facial surface, we are going to want to roll instrument handle to keep the tip adapted. As we move along the line angle, we continue the feather-like strokes and then begin to assess the mesial surface on the other half of the tooth. Of course, we will continue to roll the instrument until we explore the entirety of the tooth surface. The periodontal probe has a blunt, rod-shaped working end that is calibrated with millimeter markings. The working end and shank meet at a defined angle, usually greater than 90 degrees. The periodontal probe is very important for clinical obtaining information about the health status of the periodontum, whether the tissue is healthy or diseased. The working end is also kept parallel to the root surface and flat against the root surface as possible, with the working end inserted to the base of the sulcus. When working proximal, you're going to keep the working end of the probe in contact with the proximal root surface, and you're going to want to walk the probe across the proximal surface until a slant in the probe is slight, so that the tip reaches under the contact area. The walking stroke is the movement of a calibrated probe around the perimeter of the base of the sulcus or pocket. Bobbing walking strokes in 1 millimeter increments is inserted until resistance of the junctional epithelium. It should not be removed from the sulcus or the pocket repeatedly, as reasserting can actually traumatize the tissue at the margin. The Gracey 1112 is an area-specific curette that is designed for the mesial surfaces of posterior teeth. It has a long, complex, functional shank and only one cutting edge per working end. The face is tilted 70 degrees to the lower shank. In order to find the correct working end, you should hold the instrument so that you are looking directly at the toe of the working end. Raise or lower the handle until the lower shank is perpendicular to the floor. So which one is closer? The closest one to the floor is the cutting edge used against the surface of the tooth. There are 3 types of instrumentation strokes for root instrumentation. There's the assessment stroke, which is the feeling stroke. This does not rid the need for the 1112 Explorer, and it has to do with little pressure and flowing feather-like strokes. The next stroke is the calculus removal stroke. This is the working stroke. You're going to have firm pressure against the root surface, and they're going to be brief, tiny, biting strokes. And the bite release is limited to areas with calculus. The root debridement stroke is the finishing stroke. This removes residual calculus. You're going to want to use a lighter pressure than calculus removal. It's going to be moderate pressure with shaving strokes of moderate length. You're going to want to place the Gracey 1112 in the get ready zone. This is where the toe of the working end should aim toward the distal surface. This is where you're going to insert. Adapt the toe third to the midline and make a series of short, precise strokes across the facial surface towards the mesial surface. Roll handle slightly to maintain the adaptation of the toe third. If the lower shank is parallel to the distal surface, then you know that you are using the correct working end. The functional shank goes up and over the tooth. It is important to remember that this Gracey curette is only made for mesial surfaces of the posterior teeth. Another great note is that this instrument is made primarily for subgingival purposes. The Gracey 1314 is intended for the distal surfaces of posterior teeth. This is also used subgingivally primarily to get into deep sulcuses of periodontal tissue. As we know, this instrument is only for distal surfaces of the posterior teeth, so we are going to want to start at the distal line angle and continue distal. The face of the instrument should tilt slightly towards the tooth, and the face should partially be hidden when looking down. It is important to remember to find the correct working end and which method works best for you when finding the correct working end of an instrument. The Gracey 1718 is not part of the original Gracey series. It is primarily made for posterior teeth and their distal surfaces. The best thing about this instrument is finding its place within the distal surface of the third molar. And for finding the correct working end for this instrument, you're going to want to make sure that the terminal shank is not wrapped around the tooth. It is going to want to remain parallel with the axis of the tooth as you make your way distal line angle distal in the posterior regions of the teeth. The 204S is a sickle scaler, which is triangular in cross section. For calculus removal, the face-to-tooth surface angulation is at a 90 to 45 degree angle. The ideal angle will be between 60 and 80 degrees. You want to have the correct angulation that allows the cutting edge to bite under the calculus deposit and fracture it from the tooth surface. So imagine this. Face the angulation over 90 degrees. The face is tilted away from the root surface, being more susceptible to trauma of the gingival tissue and making it more difficult to remove this calculus. This makes it more susceptible for burnishing. When you have your face of your instrument less than 45 degrees, it does not allow the cutting edge to bite into the deposit, and instead makes the face of the instrument slip away over the calculus. It is important to note that sickle scalers are restricted to use on enamel surfaces and should definitely not be used on the root surface. The working end of this instrument has a pointed back and tip and has 2 cutting edges per working end. The face is perpendicular to the lower shank so that the cutting edges are level with one another. The instruments that we went over today are the Explorer 1112, the Periodontal Probe, the Gracey 1112, the Gracey 1314, the Gracey 1718, and the 204S scaler. So before we finish, I would like you to answer this question. What instrument is not used on the root surfaces? So, did you guess? If you said D204S sickle scaler, you got it! Okay, so we did go over a couple of instruments today, so I want you to go ahead and reflect on that and go ahead and look more in your advanced instrumentation book for further guidance. And feel free to email me or look at me in person.